This is a video on doing 99203s off the carepaths, and the internet address, the URL, if you need to enter it manually, is https://wayne.carepaths.com, and once you've opened that up, you can log in, and remember your password will be different than your Wayne State password, and it has to be given to you. And when I'm in here, I can go to my documents and see all the documents that I've made in the past. I can't open that up because that would show other patients' names, but what I'm going to do is look for our patient known as practice patient and open their file up. And here's the files that have been done by people who have practiced, including me. And what I'm going to do is open up a 99203, which is this form right here, and make a new one. So I'm going to create a new document, select from the list, and I can scroll down and pick out 99203 visits, and then make a new draft. Now a draft means that even if I close it at this point, it's going to be on there. It won't be completed, it won't be billed, but it's going to be on there to work on in the future. So first off, make sure that you're in the right date, and sometimes you'll do an interview and then come back and enter it at a later time, so you may have to back up to the correct date. And then if this is an appropriate visit, you want to add a billing code, which is, I'll pull this into the window, physician evaluation 30 minutes. This would be always done by an attending. And if you're a resident, you wouldn't do that until the attending had actually gone through it. And this is information that has been previously entered, so it auto-populates. Practice patient is hepatitis C positive. We know that from our lab tests, but they have normal liver function tests. And on a previous visit I entered, they have hypertension, hepatitis C, asthma, osteoarthritis, and low back pain. And here I'm going to enter just had oral surgery, given script for Vicodin. Here's the review of systems, and this is put in here so that you can document that you've reviewed 10 systems in order to bill for a high-level visit. The 99203 visit is actually the same level as a 99214, but the city doesn't recognize that name. So this patient has complained about fatigue, headache, and low back pain. So I'm going to enter had oral surgery. Personal family social history, you can also put down since last entered, mother just passed, increasing level of personal stress, and you add the date. They still smoke, they're still interested in treatment, but just not right now. Somebody else has already gone in here and entered medication, and for other medication notes you can put down, just got a script for Vicodin, did pill counts, and I put the date after it because someone's going to come back a year from now and not know when that was done. For the data review, the important things to look at are MAPS report. You'll be given this when you do a 99203, a set of urine drug screens. You can find out their take-home schedules by looking at the Methasoft and looking at the patient information and finding out how many take-homes they have, counseling contracts, treatment team. When the treatment team meets every week, they'll talk about what is recommended for the patient and then need for take-homes. And at last visit, they didn't have 90 days, and now they've finally achieved 90 days. And I add the date. This is a program called Text Expander that adds a date, but you'll have to enter it manually. And because they now have 90 days, if you look at the Samsa criteria, there's 8 Samsa criteria that it must be met in order for them to get take-homes. So they have to have absence of recent abuse of drugs. They're compliant because they have 90 days of abstinence. They must be coming to the clinic regularly. No behavioral problems. No criminal drug dealing. So you look at their MAPS report and there's no sign of diversion. Home environment appears safe. They've been in treatment for a minimum of 90 days with abstinence. And they have a lockbox and they have a safe place to stay. And at this point it appears to be safe to give them their 90 days. And here I'll add and this is a pull down box. It can be expanded, so after someone's been here for a while this is going to get rather full, and you can enter it either down at the bottom or down or up here at the top. Then if you're a resident, what you're going to do is put in your password and leave it pending. If you're an attending, you're going to make it complete, and it should appear now in narrative form with everything that we've entered. And that's it.